Hello friends, this is Dr. Abdul Mubin A. Mundewadi from Mundewadi Ayurvedic Clinic. In today's video, we will discuss Ayurvedic herbal treatment for AIP, which is Acute Intermittent Porphyria. Now this is a metabolic disorder, and the hemoglobin which we have in our blood, the heme part, when it is synthesized or broken down, it converts to one protein known as porphyrin, and because of a genetic defect in the body, this porphyrin gets accumulated in the body, causing symptoms like acute abdominal pain, vomiting, which requires hospital admission. If it is deposited in the skin, it causes itching. If it is deposited in the nervous system and brain, it can cause neuropsychiatric symptoms, which may be quite serious. Now we will discuss this neuropsychiatric porphyria in another video. In today's video, we will talk about Ayurvedic herbal treatment for acute intermittent porphyria. Now, we all know, or most people might be knowing, that there is a long list of allopathic medicines, nearly more than 150 medicines, which cannot be taken by patients suffering from porphyria. Just some simple paracetamol and some simple medicines can be given. Fortunately, Ayurvedic medicines, herbal medicines can be given quite safely in such patients. Of course, need to be given for a short time and by experienced Ayurvedic practitioners only. But oral medication given to such patients gradually results in all the symptoms disappearing gradually. The intermittent pain, abdominal pain which is there, that gradually stops, and itching also stops completely. Now usually we treat it as per a disease known as Rakta Pitta. We treat Dushita Rakta, and we treat all this, we give all the medicines which are used for this disease, and results are quite good for acute intermittent porphyria. Where the symptoms are quite severe, or the patient is not responding only to oral medication, there we need to add Panchakarma treatment modalities along with the oral medication. So here we need sometimes to add Nasya nasal medication, or we need to give full body massage, or Virechan induced purgation, or in some patients Basti, which is medicated enema. So a combination of all such treatments helps to completely make the patient go into remission, and we can prevent a relapse by giving short courses of treatment as and when required. Now there are different types of porphyria. There is another when these porphyrins get accumulated in the brain and in the nerves, the patient can have neuropsychiatric symptoms, and that is another type which is quite severe. We will discuss that in another video, but here we are confining ourselves only to the Ayurvedic herbal treatment of acute intermittent porphyria. Of course, the skin symptoms are included in the same treatment. So gradually, with the treatment of around 7 to 8 months, all patients go into complete remission, and we have patients in our record who have taken treatment more than 10 years earlier, who are now completely free from symptoms. They have had no relapse, and they are leading normal lives. As and when required, if for day-to-day normal medical conditions like say loose motions, fever, boils, etc., some simple Ayurvedic medicines can be given for short courses, and they respond very well to the same treatment. So patients with porphyria need not get disheartened. They can lead completely normal lives with the help of Ayurvedic treatment. So friends, this is a short discussion of Ayurvedic herbal treatment for acute intermittent porphyria. So let's meet in the next video. Goodbye.